just talk about what a patient advocate does. Didn't our first presenter say you, Skip, that you did not have a
We don't have a patient.
but all kind of do patient advocacy? Okay. My job, including being a chaplain at my hospital in Punta Gorda, Florida for 13 years, was chaplain and patient advocate, so I can talk about that issue. Your hospital doesn't have a named person, patient advocate, or some call it patient representative, but maybe a floor manager or a nurse supervisor would do that same role. And that role is taking care of whatever a patient needs. I mean, I have gone out and bought socks and underwear. I've gotten them transportation like the case manager. We all kind of work together. If you see kind of an interweaving together, we all just kind of go put up our antenna. I see a problem and fix it, and kind of report to somebody, I'm doing this, so you won't have to. So there's several different players in the hospital that kind of takes care of the needs. A patient advocate would go into every patient's room and ask them, how are you doing? What can I do for you? Is the food good? Is the TV working? Is the air conditioner comfortable? Anything to make their stay happy. And we come in there to do that. We're kind of like a hostess or a host. We're kind of like a public relations person, just whatever you name it, to fix the problem. Sometimes it's to talk about policy procedure, where they go, I think this ought to be done. Well, here's the policy, here are the guidelines, here's what we do. And sometimes we talk about patient rights, what are their rights so that we can provide for them. Some we talk about patient responsibilities. You, the patient, have a responsibility to do certain things. And so we kind of talk about both ways of making their stay as comfortable as that can be. So we're in and out of those rooms, and really every employee is a patient advocate. When every employee hears something, sees something going on, they alert somebody in administration, somebody to take care of that need. So we are all that. Now, you too, as a volunteer chaplain, are a patient advocate. Meaning, when you hear something, you just go, oh, that's interesting. It's like, no, let's get it fixed. Whatever it is, whether that was the food, the TV, or the nurse is being mean to me, or the doctor hasn't come in and talked to me yet, whatever the problem is. Or when I go home, I've got this problem. You know, we kind of talk about all these different things, and you hear things, just like they talk about the aide that was doing the bath for 20 minutes, you're in there talking to them, and you hear stuff. You know, and you're like, well, what do I do? Do I sit on this? No, I report it. Talk to someone. Ask, what can we do about this? Is someone taking care of this? And maybe case management would be the person to first alert this to, and they go, oh, we already knew about that, got it. Or no, we didn't know about that. So in many ways, we're all resource persons together. We're all trying to take care of that discharge as soon and properly as it can. So we alert each other. Any questions on some of that?